Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun.
Hey guys, do I have the show for you today? You guys know in plastic surgery, there's one procedure that you can never not talk about. And those procedures are breast procedures. So today I have a wonderful plastic surgery expert, Dr. Ashley Steinberg. She's a board certified plastic surgeon out of Houston, Texas. Hello, Dr. Steinberg.
What up?
And you guys are going to know very quickly why Dr. Steinberg and I we just mesh. We just get along. There's different personalities in surgeons. And when I tell you guys to find a surgeon that you align with, this is what I mean. You find a surgeon that you align with, that you get along with their personality, you love their work, you love their ethics. That's how you find a good match. So Dr. Steinberg is a breast expert. So breast lifts and breast reductions are one of those procedures that we just cannot not talk about. So Dr. Steinberg, give us a full rundown on how to pick the right procedure for your breast and all of the info that my girls would need to select a breast procedure.
Alrighty. Well, to start, I would just like to say I love boobs. So I love that we're talking about boobs. I love everything boob. So usually it's women. So when it's a lift, it's women who are sitting in front of the mirror and grabbing their boob and like lifting it up or raising their arms up in the air or something like that and saying, I wish my boobs look like this. They look good when my arms are up in the air. Or, like just standing in the mirror, hoisting them up or something like that. And they're not really sure what they can do. So that's usually when you need a lift. And depending on if you want some more fullness, it's plus or minus, a implant or some fat grafting. And then a reduction is usually those patients who are like, I can't find a bra in a normal store. I have to like get my bras specially made and they're so expensive and they dig into my shoulders and I can't run and my back hurts, my posture's bad. So those patients are usually very apparent, the breast reduction patients. The lift patients, sometimes patients will come in and they're not sure what they need. And a lot of them are a little bit afraid of the incisions, especially if they're not sure and they don't realize what they need. A lot of people are afraid of scars and incisions. So that's usually a discussion that kind of comes up during the consultation.
So, Dr. Steinberg, why don't you tell us a little bit about the incisions for breast lifts? And I know there's so many surgeons out there, and I don't want to say gimmicks, but there's some procedures out there where they're like scarless breast lift and, this no scar lift. And why don't we talk about that? Because, I want to tell my girls, our listeners, what they can expect to see out there and what's really possible and what's not possible and how to not waste their money.
I'm going to get real passionate. So real intense right now. So there is no such thing as scarless unless someone's not touching you with something sharp, which is fake, like they're waving a wand at you. You know what I mean? There's no such thing as scarless. Anytime someone cuts you or touches you with something sharp, it's going to create a scar. Now, that scar may fade to not noticeable depending on how you scar, your skin tone, things like that, but there's no such thing as scarless. So I just want to say that first. Now, there are a bunch of different types of lifts and reductions. So there is something called a circumareolar lift where there's just an incision around the areola. Now, I think that in practice, I've done that one time because I don't think that is a first of all, it's not a powerful lift. It can only get you about 2 centimeters of lift. Secondly, it is very, very, very common to have widening of the areola with that because, and I'm going to get a little technical, but it's all about tension. So when you have this circle, the tension goes outward and inward, but the highest tension is that outward tension. So it's pulling that scar out and creating this large areola. Whereas if you add a vertical component, you redirect the tension. It's all physics. Redirect the tension to that vertical component from that circle, and you don't get widening. So I would say that if you see someone with really large areola, they probably had, with a scar, they probably had that procedure. And I do not recommend that procedure. I would almost opt to do a full scar with the vertical. And I know that that's what scares people, but I think that you'd rather have that scar than, like, I literally had a patient with 9-centimeter areolas after that.
Wow.
And 9 centimeters.
Yeah.
So it's like an actual pancake. And then to revive those afterwards is very, very difficult, because then you have to do a regular lift and the areola is in the right place, but you have to try and make it smaller. So then they end up with pieces of areola like on their incisions, and that's getting very technical. But so the point is, do it right the first time. So circumareolar lift, that's one. And that's very common. Like when I do that, I usually do it for a tuberous breast. That's very much indicated for a tuberous breast. And you may ask what a tuberous breast is. I would Google it. It's a constricted breast. It's high up. It's those people, they tend to come in and they aren't sure. They don't know that there's anything wrong. It's a congenital abnormality. They think they're coming in for just a breast augmentation because they always had small breasts, but what they actually need is an augmentation plus this lift. So that is a good indication for a circumareolar lift. Now, other types would be a circumvertical, which is around the areola and then down, just that vertical incision. And then an anchor, which is around the areola, down and underneath, looks like an anchor. Now, I personally probably 99% of the time do the anchor because I think it's the most powerful technique to be able to narrow the breast vertically as well as horizontally. So it's very hard because you want the dimensions to be so nice to get it that round shape. It's very hard to just do that with a vertical. You really have to take off a lot of that horizontal excess, especially in a reduction, especially in large reductions. There are times that you could, in patients who need a small lift where they just may need a vertical, or they'll need like a letter, like a J, where it's not a full anchor, but it kind of goes off to the side just because they need a little bit of excess trimmed from the lateral portion or something like that. But the breasts tend to heal really, really well. And again, not scarless. But what I always tell people is if someone's seeing those scars, they don't, like, at that point, they don't care. Like, you're naked in front of someone, you know, whether it's your man, your woman, whatever, they ain't like, oh my God, look at those scars. We're done here. Put your shirt back on. You know what I mean? So
that does not happen.
No, it does not happen.
Put your shirt back on. Your scar's too ugly.
Yeah, exactly. As if.
That does not happen.
No.
And you guys, on the breast, I feel like the incisions look so much nicer. The breast vertical scar, most of the time when we're seeing those in post-op, like a year, 2 years later, it's barely visible. You can barely see it. I mean, mine, let's see, I had mine in 2019. So 2020, 21, 22, 23. So mine are 4 years old, and I can barely see anything. It looks skin tone. You have to like really look at it to see the light scar. But in my experience, they're not ugly scars like most women believe they'll be.
Well, and you always have to think, like, anytime you have surgery, anytime you show up at a plastic surgeon's office, whether it's for a mole or breast reduction, would you rather have the large breasts or the low, sad, haggy breasts? Or would you rather have this scar that usually takes about a year to fade, but often fades? Like, that's what you have to think about. Would I rather have the before or the after with the scar? And most of the time it's the after with the scar.
Definitely. You guys know that my breast procedure has been my favorite procedure. I had large breasts my whole adulthood, my whole life. After kids, I breastfed. They were huge. They after my tummy tuck, they did not fit my frame. They were just too large. And it was one of the best decisions I made, having a breast reduction, a lift, and a little implant. That upper pole.
That is something also, thank you for reminding me. So a breast reduction, some people will come into my office, and I just want to put it out there. Sorry to all the plastic surgeons that do this, but a breast reduction is a breast lift with a reduction of tissue. I have people who tell me that they went to see a doctor and they take insurance for the breast reduction, but not for the lift part. They have to pay for that. And I'm like, no, I want to see how you do a breast reduction without lifting the breast. Like, that's not okay. I still take insurance for breast reductions that I'm taking less and less just because insurance definitely makes life very, very difficult, but it is very rewarding to me to do those cases, not financially, but in the heart. It's the heart reward that I like because those are my happiest patients. So I still tend to do that, but it covers the entire thing, the reduction and the lift. So it is not going to cover an implant. It is not going to cover fat grafting. It is not going to cover a small lift that does not have a reduction. There are requirements by insurance based on your body surface area, which is a calculation of your weight and height on how much needs to be removed. And some insurances just don't cover it in general. But if someone tells you that a lift does not include a reduction, run, because they're lying and they want to take your money.
Yeah, I could not agree with you more on that. So I'm going to rewind back a little bit. So if anybody who's listening to this episode and is considering having a breast reduction and you have health insurance, your insurance could possibly cover your breast reduction if you meet the requirements that your insurance has. So some of those requirements are, there's a calculation where we calculate your BMI and then we calculate your body surface area. And then we calculate, okay, well, according to your body surface area, how many grams need to be removed in order for it to be considered approved by insurance. And depending on your height and your weight, that number can go up. And sometimes in order to get it approved by your insurance, the amount of grams that have to be removed to meet the requirement will leave you flat.
And that is exactly right. And I always tell my patients, and sometimes I have patients come in and I look at them and I'm like, oh yeah, you're going to get approved. But sometimes I'm like, listen, I'm going to say what I think. If they don't approve it, I'm not doing insurance. I'm not doing surgery so that you can have surgery for free and make you look like a man and not want to look in the mirror anymore and hate yourself. Like, my ultimate goal, I know it's insurance, I know it's reconstructive, but my ultimate goal is I want you looking and feeling good and looking at yourself naked and feeling proportional. So I'm not going to do something just because they tell me to do it a certain way or because you tell me you need it covered 100% by insurance. I'm sorry. I want to make you look good. That's like, I want to make you look and feel good. And that's kind of the ultimate end goal here.
Mm-hmm. So sometimes when you have that decision in front of you, like, do I go with my insurance and have to have this amount, whatever amount of grams it could be 500 per side. It could be 1,000 per side. It depends on how much you weigh and how tall you are and how big your breasts are. So depending on that amount, if you're facing that decision on, should I just go with the full amount, the amount that they're requesting, just know that the purpose of that amount is to make the removal of tissue enough to alleviate the problems that you're complaining of, the back pain, the neck pain, the shoulder pain. So in order to alleviate those, you have to remove a certain amount of grams, right?
Yes. Let's always remember that insurance companies are not for you, they're for them, right? So the reason why they approve things like this is because they want you to stop going to the doctor and complaining about back pain every 3 months. They want you to stop using those prescription medications. They want you to stop going for the rashes that you get under your breast. They want you to stop using your insurance for chiropractors. They want you, you know what I mean? They want to save money in the long run by you not having these complaints. That's why they're like, up front, I will give you this money for the breast reduction if it means that you're not going to go to the doctor for these problems. And then they don't have to keep paying out via the insurance. And that's why they do it. It's for them.
Exactly. So if you're thinking about it, you already know who to go to. Dr. Steinberg can help you with your breast insurance case. But if you are not thinking about it and you're just going to go with the non-insurance, do what makes me look the best, also Dr. Steinberg can help you with that. But so now let's say that's insurance is out of the picture and we're choosing the right procedure for you. Let's talk about upper pole fullness.
So upper pole fullness is something that 18-year-olds have that have never had a child or have never lost or gained weight. That's what upper pole fullness is. It's like something that people come in and they'll say, I want my breasts to look like what they did when I was breastfeeding and they were full of milk. That's upper pole fullness. It's that big kind of in your face breast tissue that's up high. How do we lose that? Lots of ways. Age, saggy skin, weight loss, breastfeeding, not even breastfeeding, just having a baby and then the breast filling up and then going down, any sort of like change in your breast is going to cause loss of upper pole fullness. And there are varying degrees of what upper pole fullness should be naturally versus kind of, unnaturally. Maybe somebody comes in and says, I want to look like a porn star, or this is what I do for a living. I've had people say that, or they dance for a living, and that's totally fine. That's, it's the aesthetic. So a good thing to do is bring pictures, because that will let me know what the upper pole fullness that you're striving for is. But also, I will tell you straight up, if you show me a picture of an 18-year-old girl without kids and you're like 50 and you're overweight and you've had 4 kids and you breastfed and your nipples are at your knees, I'm going to tell you, it's never going to look like that. Like, I'm going to be very, very realistic and say, I do the best I can with what I have. But that girl is like 40 years younger, no kids, chill out. And I'll show you pictures of, I have millions of breast pictures of patients that I've done. I'm sure you could find someone that looked like you before, and we can show you options of what you can look like after. And the only way to really get increased upper pole fullness is with an implant or fat grafting. And again, varying degrees. Fat grafting is going to give you the least. Well, nothing. If you do nothing is going to give you the least, but fat grafting will add a little bit of volume, but not much. It's just going to give you that little bit of oomph, like maybe half a cup size. The max you can usually fat graft is about 300 cc's per breast, which probably about 200 of those cc's will remain, which is a cup size-ish, depending on your size. And then you can go implants, and you can go from small to very large, and projecting to non-projecting, cohesive to not cohesive. And that's a whole other conversation, but that will also change how that upper pole fullness looks.
Absolutely. So in your practice, which of the profiles do you like the most? Which implant profile? And actually, let's talk a little bit about the different implant profiles.
Okay. So I actually use all 3 implant companies. I think you're not going to find a lot of plastic surgeons that do that, because it's not financially advantageous for a plastic surgeon to do that, because of course, if they use one product, they're going to get a better deal on it. I really like having all 3 because I think that there's a place for each of them, and they all have different strengths and weaknesses in different areas. So I actually have Mentor, Sientra, and Allergan implants. Now, the gels are different, the profiles are different, the numbers are different, but I'll just say in general, it usually goes from like an extra low to an extra high profile. Now, I think the sweet spot personally is moderate plus. I will sometimes use high profile. I use those in younger patients, often patients who don't have any breastosis. That's for an augmentation only. And extra high, I'm like not a fan of. I've done it a few times, and it's not what you think it is. Sometimes it's the cohesiveness that you want. And what do the profiles mean? It's basically at a small, so the width of the implant is what determines the profile. And at a larger width, you're going to get a lower profile. Because if you think about it, as the width, say you have 400 cc's, as you widen the implant, the top or the projection of it is going to get lower with that same 400 cc's. If I were to squeeze that bottom and make the implant diameter smaller, it's going to make the projection go up. So that's making it a higher projection at a smaller width. So then there's the cohesiveness, which that's another thing that each of the implant companies have that differs. But the higher cohesivity is if you turn an implant on its side, you'll see less wrinkling with a higher cohesiveness. It's tighter cross-linking of the gel. So a natural breast, like the perfect breast, is supposed to be 45% upper pole, 55% lower pole. Some of these implants, like the Mentor Boost, the cohesive Allergan implant, and then the 107s of the Sientra are kind of up there. They strive to give more of a 50-50, which is more of an unnatural look. I use those in breast reconstruction when a patient doesn't have breast tissue and we want less chance of rippling. But there's a place for them in a patient who comes in and they say, I want these very high round breasts. Very rarely do I use that in cosmetic or elective procedures, but there are times and places for it.
Would you agree, Dr. Steinberg, that patients should not get hung up on the numbers?
I 100% agree. I am like, you can't get hung up on a letter. Like, I don't want you to come in and tell me you want to be a D cup, because if you go to Victoria's Secret, they're going to tell you that you're a triple D when Dillard says you're a C. You know what I mean? Everybody's different. So don't come in with a letter and don't come in with a number, because your 400cc is going to look so different on someone who's 5 feet tall and 100 pounds than, me, who's 5'5" and 150 pounds, is going to look very, very different. And it's also based on the width of your chest, how much breast tissue you start with. So what I do is I take my measurements and I basically it's usually around 6 implant sizes, profiles based on what we talked about, what you're looking for. And I give them to my lovely coordinator area. And I say, here are the sizes that I think would look good. And then she does sizing. So we have a sizer kit where they look like little chicken cutlets that you put in a bra and you try them on, and it helps to see. And if a patient is like, I want bigger, or I want smaller, I can work with that to an extent. There is a level where I'm like, no, that's too big. I'm not doing that because it's not going to look good on you. You're going to get bottoming out. You're going to have all these complications. But usually I can't remember the last time she's had to come in and say, hey, they don't like any of the sizes you chose. Because I can usually tell by what they're telling their goals are, plus the measurements I took.
Why don't you tell us a little bit about the measurements that you take? What are you measuring? How do you decide on a patient?
So important. So when I do an exam on breast, the first thing I do is I feel around for any lumps or bumps, because I do require mammograms in anyone over 37 years old. And if I feel anything, I will require a mammogram or an ultrasound. So that's first comes first. And then I do my measurements, and I measure from the sternal notch to the nipple, which is basically a measurement of how tonic or saggy your breast is. So if you look at a textbook, they say the perfect number is 18 centimeters, which I'm like, the only time I've measured 18 centimeters is on someone who is like 18 years old, 100 pounds, 5'2". Like 18 is crazy. I think that, and I've seen anecdotally that the taller you are, the longer that number should be, because it's really based on your torso length. So like if someone is 5 feet tall, I'll tend to put theirs closer to the 18 to 20 mark. But if someone is like 5'9", I'm getting more to the 20 to 23. But I do that measurement first. It tells me, if we need to move your nipple, where we may need to move it. And usually anywhere from 18 to 23 is kind of a normal range. And then the next measurement I do is the base width. And now this is when it comes to implants, this is your most important measurement. And this is a very difficult measurement to get because the breast is round, and I'm trying to envision what the width of the chest is underneath that breast. So you're trying to get a flat measurement on something that's round. So some people use calipers. I think by this point in my career, I just can figure out how to do it. And, it takes some time in the beginning, but you kind of figure it out. And that measurement, anywhere from, 10 to 20 centimeters is what you're going to base your implant on and your implant profile. And I usually will go plus or minus 1 centimeter on that width when I'm looking at implants, depending on the goal of the patient, what they told me they're looking for. And then, so most important for implants is the base width. Most important for lift and reduction is that sternal notch to nipple distance. And then the next measurement that I do is nipple to fold distance. And that perfect measurement is somewhere around 7 to 10, maybe 6 to 9, because anything longer than that is what's called pseudotosis. It's where you have a bunch of tissue that's kind of hanging out from underneath your breast. Or if it's tonic, where your nipple is really, really low, it's just that you have a long breast and a lot of breast tissue. And that's where that horizontal incision that I talked about with the anchor is really, really powerful in making that breast smaller in that horizontal dimension.
Wonderful. Thank you so much for explaining that to us, because I know my girls are always asking about high profile. And I feel like there was a phase where a lot of my girls, or a lot of the girls online, are looking for high profile just because they believe that it's going to achieve a certain look. But what I want y'all to know on this episode and with Dr. Steinberg here is that sometimes, like, you can want to have a very voluptuous look, but you don't have to have a high profile implant to achieve that. There's different profiles that work just as good on your frame. It's just finding the right match. It's finding the right implant. It's like a shoe, kind of. It has to fit right to give you the right height, to give you the right look. It's a lot more than I want high profile. I want high profile
Well, it's finding the right implant. It's finding the right doctor, because sometimes you'll walk in and there are people, cosmetic surgeons maybe around town. I don't know who. You walk in and you're like, this is the implant I want. And they don't have the education, the experience, or the wherewithal, the caring to even sit there with you. Like I sit there, my patients, my consults are minimum 30 minutes to an hour long. And I really want to know what you want, because you're going to be mad at me if I don't give you exactly what you want, even if it looks amazing. So it's also really finding that right doctor who's listening to you and understands, but can also tell you the truth of what outcome, what they can actually give you, and don't, over promise, under deliver kind of thing.
Absolutely. I can tell you, Dr. Steinberg, I've had girls who, one particularly who sticks out in my mind, that she's also a Houston native. She went to have surgery and with the male doctor, with the male surgeon, and her husband was with her during her consultations. And she felt pressured into a larger size than what she really wanted, because of the surgeon saying, go a little bit big, going bigger, and her husband agreeing. And she ended up with like 550s. And she's a tiny little girl. She ended up with 550 saline implants. And now when I was talking to her again, but she's like, they're saggy, they're super heavy. I can't stand them. I liked my breast before. So I want you guys to listen to that. And when you're making your decision for your augmentation, for your breast, for any of your surgeries, you can take your spouse's consideration, of course, especially if they're paying for it. I guess you can have a little input, but ultimately you're the one that has to walk around with that on your chest. So if you do not want to go big, do not let anybody pressure you into going bigger than what you're feeling comfortable with. And I want you to take that and really, when you're looking at your implants, think about it. Am I doing this for me? Am I picking this size because I want this size, or am I picking this size because somebody else wants me to have this size?
I'm going to tell you, that's a huge red flag. If I have a husband in there doing the majority of the talking or asking those things, I will, like, I'm sorry, I walk into the room, I introduce myself to both the wife, the husband, whoever is in the room, always. I'll listen if you ask me questions, but I promise you, I will 100% ignore you if you give me any input on sizing or something like that. I am not doing this for anyone but my patients, and I'm hoping that my patients are not doing it for anyone but themselves.
Absolutely. But how often do you have husbands in there?
I actually most recently had a mom tell the patient, no, that's not big enough. Do you have to go bigger? Yes. And so she's this really, really petite girl. And she actually came back on her own separately and was like, I want to resize because I think I actually went bigger because my mom was there. And we went with a smaller size. And she's so happy. And she's like, I think they are so perfect for me. And she's like, my mom is still saying I should have gone bigger. And I'm like, please don't do that to people.
Please don't do that.
That's like when you're eating something and somebody doesn't like it and they're like, ew, that's disgusting. I can't believe you're eating. Like, that is, you know what I mean? It's just like, why? It has no effect on you. Why are you doing this?
Why are you commenting?
Now you're affecting me because I'm getting self-conscious about it.
Yep. I hope that people who listen to this episode hear that and also self-reflect on keeping your comments to yourself if it's something that can't be changed in 10 seconds. If it's something that this person in front of you has to live with for a long time, for the rest of their life, unless they have surgery, unless they fix it, it's better to just keep it to yourself, because I can tell you guys that I hear the comments from my girls when they're telling me, well, this didn't bother me until somebody pointed it out, or things like that. So with that in mind, if you don't have anything nice to say about somebody else's surgery, it's better to just don't say anything.
Don't give your opinion unless you're asked for it. If it's your best friend who's like, hey, I'm going to get naked and this is what I think. Do you agree with me? Fine. But like, your opinion on someone else's body, whether they've had plastic surgery or not, is not warranted, because you do not know how someone is going to take it. Like, I don't care if you think telling someone that they look good because they lost weight is a compliment. Guess what? It might not be, because you might think that they might feel insecure because of their weight loss or something like that. Opinions on people's bodies, and I know this has nothing to do with plastic surgery, unless somebody asks you for it, just don't do it. It's never good.
It's not good. And it causes insecurities in people. And I think this is a really, you as my guest and this episode and this topic is perfect for us to talk about different types of consultations and surgeons and how surgeons give different types of consultations. Let me tell you guys. So a few years ago, a while back in my career, I took a sales course. And in this sales course, they were teaching us, this was a very expensive sales course. And they were telling us that we had to get our mirrors, our 10X mirrors, and give them to the patient and point out everything that we could change on their face, or if whatever their body part was. Like, okay, give them the 10X mirror and then point you. This is literally what he said. You break them down and then you build them up with what you can offer.
Do you see my
I swear to
face right
God,
now?
this is real.
You got
This
my
is
face
real.
right now?
I really
Okay.
did take this. And I remember I was with my coworker and I was like, we were looking at each other.
Does this sales course start with a Y? Did the company start with a Y?
Yeah, I don't remember. It was a while
Okay.
back. I just
Okay.
remember the color. It was yellow.
Yes. Yes.
Yeah.
Yeah. Y. Yellow.
Yeah.
Exactly. Yeah. I
Yeah.
know exactly who you're talking about. Oh God.
Yeah. And they were
Whew.
like, yeah, you can order 10X mirrors on Amazon on bulk, put them in every room, and you do this and you do that. And me and my coworker, we were just looking at each other and we're like, I am never going to do that to somebody. Y'all do this? Oh, and the guy was so proud. He's like, I'm not even going to say what he was saying. I'm just going to shut up. But that showed me also that there's different types of consultations, even in other parts of aesthetics. I already knew, like with plastic surgeons and their consultations, that there's different styles. And I want Dr. Steinberg, why don't you go and tell us about how I call it the art of the consultation?
So important. So when I was in training, I would go to clinic and I would see different doctors doing their consultations and kind of get a feel for everybody's style. And I think I adapted, in addition to kind of my own personality, a couple of my mentors, Don Collins, who is a private practice plastic surgeon in the area, and then Jeff Friedman, who's the chairman of plastics over at Methodist. I would say two of my big mentors, two of the people I sort of emulate in my consults. One, Don Collins being like the best listener, the nicest person. I'm definitely not the nicest person, but he's a really good listener. So I got that from him. And then Jeff Friedman, who makes jokes, is funny, is chill. I put kind of both of those together and then added my quirky personality. And so for me, I'd say that my consult style, very, very different. Like most of my patients are coming in, they're like asking for Ashley or Dr. Ashley because they already feel very comfortable with me, which is fine. I go by many names, whatever you want to call me. I walk into the room, I'm wearing something bright. I'm like, hey, what are you doing here? Like, what brings you in here to see me? I might curse by accident. It's not really by accident. I can't help it. I'm going to make a joke. If you tell me you're from somewhere that I've been, I'm going to ask you where the best place to eat is. Like, we're going to get off on tangents. I want to know about your life. It's going to give me an idea of like who you are as a person. You're going to hear a lot about me. And then we're going to talk about goals, and I want to listen to you. And I'm also going to be realistic. And guess what? When someone says, what do you think? I would say, what bothers you? I would say, you could do this, but if you weren't even thinking about it or you don't want to do it, I'm not here to add surgery. It's if they ask me, I will say that. And I am very, very conscious of, I never add something, because you can add something to somebody. It can turn out wonderfully, but if they didn't want that, they're going to find something. They're going to be unhappy because they spent the money on it. They were never thinking about it. And now they're thinking about it now. And they're finding the most minuscule little thing that's going to bother them because they never even planned to have it. You know what I mean?
Mm-hmm.
So that's my consultation style based on my mentors. Now, I think it's very different than what people are used to. I think some people walk into a plastic surgeon's office and they expect, I had somebody back in residency when I walked in, they were like, you're the doctor? Like confused, because first of all, Dr. Steinberg sounds like an old Jewish man with like a mustache who's going to walk in. I mean, I'm sure you did your research and you know who I am before you came to see me. But I think a lot of our vision in plastic surgery is, 80% or more plastic surgeons are men. So we think of this like kind of man in a suit, a very expensive suit, or a man in scrubs that's tall, a little bit of like father type figure, someone you don't want to disappoint. Maybe you're a little bit afraid to say things in front of them. They're, 95% of plastic surgery patients are women, so they don't necessarily feel as comfortable talking to a man as, they would a woman. The majority of these men are older men, especially just, the age group, kind of boomers age group. So it is very different, I think, than what we think as a consult is. You go in there and you be quiet and you let them talk to you. And that definitely happens. And I've seen it. And there are plastic surgeons who spend 5 minutes or 10 minutes with somebody and they tell them, this is what we're going to do. And that's it. And man or woman, it's not, I do think women are a little bit better and they listen a little bit more. And, there's something, because,
Special.
yeah, we get it. It's empathy that a man can't have, right? Because they don't have a vagina. Sorry. Like, I'm sorry, but I understand because I have boobs. And women say that to me they'll come in and they'll say something like, you're not going to leave my areola big, are you? Because I've seen some pictures where they're just, and I'm like, no, man, I wouldn't want big areola. I use the smallest size that there is, unless you tell me otherwise. They're like, yeah, because I've seen some men's pictures and you know what I mean? So I really think consultation style, it's different for everybody, but I always say, some people want that. Some people want that like rigid, like, this is what's going to happen. I want what I think, what it is like on TV. I want somebody to tell me how it is. And that's fine. That's not me. And that's great. Like I do just fine. I'm happy with the patients I have. And like I always say, like, if I'm not the person for you, I hope you find that person. What I tell every patient, even the patients who come see me, whoever you decide to go with, make sure that you get that feeling, that woman's intuition, that gut feeling that says, this is my person. Because if I have a problem, they have to, number one, know how to fix it, but also be approachable enough to say, hey, this is my issue and what should I do about it? Because if you're scared to talk to that person, it's just going to get worse. I have a lot of patients who have complications and they won't go back to that original surgeon. I don't want that. If you have an issue or you don't like something, I want you to come back to me. I want to fix it. Like, I want you to walk out and be so happy. If any little thing bothers you, I want it to be perfect. And a lot of people aren't approachable and they just will never go back to that person. And if you feel like that's the kind of person, because you don't know, you could be that 1 in 100 that has that problem. If you don't feel like you can approach that person and tell them, it's probably not the doctor for you.
Mm-hmm.
A bedside manner is a thing. Some people don't care about it. Some people think it's the ultimate. I think I'm a little bit of both. Like, I don't think I have the greatest bedside manner. I mean, I do curse a little bit. I'm a little off color. Like, I might, I'm not going to be like the hold your hand, be your favorite person in the world, but I'm going to be there for you. I'm going to do what I need to do. And I'm a good surgeon and I will fix anything I need to fix. But there are people who are amazing surgeons and are just like watching paint dry when you talk to them. And you're like, I never want to talk to this person if I don't have to. And then there's the opposite, who are these horrendous surgeons. Sadly, they exist and they're just really nice. So they continue to get business because the patient will come to the office with their nipple falling off and they'll hand the doctor their nipple and they'll be like, I'm so sorry I did this. Like, it's my fault. But like, the doctor is so nice that he's like, they'll still come back and have another surgery with them. You know what I mean? So
You're so right.
You have to, and like, if you're cool with that, like, you just want somebody who's going to like be all about it and be your best friend and go out and have drinks with you and might not be the best surgeon, that's fine. You have to figure out what works for you and like what you feel. Like, I always think gut feeling is everything. I know that people poo-poo gut feelings and whatever, but with women, like, if you feel like something is going on or you feel something in there, don't doubt that. It's like 90% correct. I want to say that's a random percentage I gave, and that's based on my experience. But I really do think that women's intuition, gut feeling are very important.
Absolutely. So with all of that you said, you brought up a really good point that there's some surgeons that their results suck. Their bedside manner sucks, but they have so much freaking charisma that they close clients every day. They got so many surgeries And it's just because of their personality, and they have this charisma that just convinces patients to have surgery with them. But the results of the women who are having the surgery suck. And there's actually somebody here in town who he's a cosmetic surgeon. And I'm not saying, oh, all cosmetic surgeons are bad. There's some cosmetic surgeons out there who are killing it and they're really, really good. There are other cosmetic surgeons out there who are not good and they're not killing it. They're giving bad results.
There are even plastic surgeons like that too.
That's true. You're very true. You're very true. You're saying something very true there, because there is board certified plastic surgeons on the same boat. But there's one specifically here in the city that I guess you can say I have beef with him. I have beef with this.
I have beef with
office.
anyone. So I have beef with anyone who doesn't do right by a patient. Okay. I'm sorry, but like, we chose to have this job not to make money, not to have fancy cars, not to go on fancy trips. Like, I am in my 4th year of practice. I drive a Hyundai that I'm very proud of, that I just bought. You know what I mean? Like, that is my first car that I bought. It's a Hyundai Santa Fe. It's pretty bomb. You know what I mean? I'm not out here driving like fancy cars because that's not why I did it. You got to deliver the promise to the patient of the training that you had. 8 years I spent in a hospital following doctors, doing surgery, getting paid like nothing and working very, very, very hard because I need to produce. Every person that walks out there is my billboard. This is what I've dedicated all of my time to. Missed weddings, missed funerals, missed like happy events, sad events, all the things for. So I have beef with anyone who doesn't deliver, who's doing this for any reason other than just making people happy and doing the things that we have this opportunity to be able to give to these people. The best thing in the world is when a patient comes to me and says, this is the best decision I've ever made.
I got chills. I hear that all the time and it makes me so happy. Let's look at this picture. Okay. Have you guys seen this picture on Instagram of a before and after from Turkey? I'm going to put the link in this episode so y'all can see it, because there's this facelift before and after. And the woman I swear, she looks like she was her grandma and now she's the daughter. Her results are amazing. And I saw that picture and I was like, now you tell me that woman in that after picture is not a completely different person on the inside and out.
I need to see it. Absolutely. There's some people where there are celebrities, we call them out all the time, whatever. But I always want to say that, whoever did Jane Fonda and Martha Stewart's facelift, like, I need to know because that's who I want to go to.
Oh, I know. I have it. I have the info if you need it.
Oh,
I have Martha Stewart's surgeon.
I am not paying $400,000 for.
No, he wasn't. He wasn't
okay,
40.
Good.
He was like 65.
Oh, that's not so bad. There are some people out there that are like $500,000, but those women look incredible and they probably feel incredible. I'm always like, that person knows what they're doing. Like, I want to go and I want to watch because that's amazing. You know what I mean? Like, I spend a lot of time. I'm actually flying to Las Vegas on Wednesday to go watch someone do surgery who's very well known for breast surgery. I've been to Shreveport to watch Holly Wall, who's incredible. I went to North Carolina to watch Dr. Cortesis and Bahardi over there. They own a lot of practices, to watch them do surgery because I want to I want to do the best thing I can for people. So I will fly places and just watch people do surgery just to get better and see what different techniques there are. But like those in particular, I don't do facelifts anymore. I'm in an office with a facial plastic surgeon. I concentrate on body, but man, I would just love to be in the room to just see how you can do that. It's amazing.
Those facelift results, man, life-changing. And of course, it's a combination. For anybody who's considering a facelift and you're like, oh, you want results like Martha Stewart. The first thing I'm going to tell you is that Martha Stewart had more than one surgery. I don't mean more surgeries like on different days, but I mean, it was a combination of multiple procedures done at the same time together. So she had a neck lift, facelift. She had fat grafting. She had an upper and lower left, probably maybe fat grafting to her cheeks. I think she might have even done a brow lift. There was a lot. It wasn't just, oh, I go in and I have a facelift and that's it, which a lot of times I believe women are going in and they're having like mid facelifts and they're expecting to see the same results as like a Martha Stewart before and after, but it's a lot more procedures. It's not just like a mid facelift or a neck lift.
Yeah. And it's not just a small incision. My favorite is when like someone comes in for a tummy tuck and they've seen other people with tummy tucks, but they're not seeing them walk around naked. They're seeing them with clothes on. They look amazing with clothes on, but they're like, wait, there's a scar. And I'm like, yeah, there's a scar. That's why I showed one of my Instagram things is like that I did a little while ago is like, what's under the underwear? And I was like, this is what she looks like in underwear. She looks amazing. Here, let's take her underwear off. Look, there's a scar there. You have to have a scar. I mean, it may fade over time, but like I said, if someone is cutting you with something and you want a good result, the more of an incision, the more result you're going to get.
You know what, Dr. Steinberg, you brought up a really good, and we're just going to touch on it because this episode is not about tummy tuck and liposuction, but we're talking to a body surgeon. Let's talk about it. So, okay. One of the things that I always have to talk to my one-on-one girls about is my one-on-one clients, because I have a lot of adult industry girls. They don't want scars. They don't want anything, any incisions. But what I have to explain to them sometimes is like, okay, if we do just liposuction to your abdomen and to your flanks, and we do not do any skin removal, you're not going to be happy. If you have stretch marks and loose skin around your belly button, in the lower abdomen, if you have had a pregnancy, even if it's just one, if you've had a pregnancy, if you've gained weight and lost it.
Preach, girl. You are absolutely right. You need to tell that gospel to the world, because I have people coming into me who have like straight up diastasis or saggy skin or hernias or whatever. And they're like, can I just get liposuction? I'm sorry, but abdominal liposuction is good for very few people. You'll see the best results are on patients who've never had surgery. They've never had children. They have really thick skin. There's so few people that when they come in, I think I have one person in the last year that I was like, okay, I'll do abdominal lipo on you because it will actually work. Yes, you need the incisions, you need the scar, you need the tightening. Lipo is not everything. So the areas that are the best bang for your buck when it comes to lipo, posterior flank, 100%.
Absolutely.
That's what gives you that curviness. But I usually do that in addition to a tummy tuck, and then submental. Those are the areas that you're going to see the biggest difference with the least amount of risk of having, issues with contour deformities, lumpy bumpiness, irregularities, stuff like that.
You're so right.
And I just want to say, I love my industry girls. So you all should come to me because I love you and I want to hear everything about you and I want to help you and I want to do all the things. Those are my faves.
I know.
And then my LGBTQs, these are my favorite patients.
I love it.
To everybody else. But.
To all the other ones. I like y'all too.
I like you too. Yeah. I like colorful. I like fun. I like talkative. I like everything. So if you're those, please come see me.
You'll find your match with Dr. Steinberg, because let me tell y'all, the other day, I accidentally walked into her office. Walked into her office. I was in her building and I was like, oh, this Steinberg's, God, I've been wanting to be here. It is beautiful. The view, the vibes, the energy in there. It feels so light. Yeah, I don't know if you sometimes you walk into a plastic surgery office and you're kind of like, oh, I don't want to touch anything. I don't want to break anything because it just looks so fancy and so like, ooh, your office gave such a nice, like freeing energy, like such a nice vibe. I felt like we could talk, and her office is beautiful, colorful, just like her personality.
I will say, I always credit where credit is due. Angela Sturm, who's the facial plastic surgeon in the office, who happens to have the same initials as me. She had a designer. It was her vision and she did a wonderful job. I was so lucky to come in and she had this like purple and gray office, which are my colors, and her initials are AS. So they're everywhere. And she's got a very similar style to me. My personal office is a little bit more eclectic. I've got like, the rainbow monkey, and I've got like the labia and a papaya, and I've got needlepoint of boobs, and there's little like boob crochet things everywhere. So mine's a little more eclectic, but you're right. And we do spend a lot of time, like me and you hung out at the front and just chatted. Like you'll see me up at the front, like chatting with patients or whatever. I'm not sitting in the back room and just, you can't approach me by myself. I'm just out there hanging out. It is very easy. We have events here. It's a great event space. It's awesome.
I love it. All right, Dr. Steinberg, I don't want to keep you for too much longer. Why don't you tell our girls where they can find you and give us your Instagram handle, give us your office contact.
I could talk all day, but fine. My office address is 6750 West Loop South. We're on the 10th floor in Suite 1060. That's right off of 610 in Bel Air, literally right off the highway outside of the loop. My Instagram is at Ashley Steinberg MD. And phone number to the office is 832-519-0099. Feel free to call. You can text that number. I get all the texts. You might actually get a personalized answer from me. You can also DM the Instagram or whatever, get a hold of us. I'm excited to meet everybody.
Yay. Thank you so much for being on the show. It was so nice to hear you be our expert and tell us everything we needed to know about breast, about implants, about the consultation process. Thank you so much. You were so much fun.
Thanks for having me, Mavi.
All right. Bye.
If you enjoyed this episode, please go on Apple, write me a review. It's the best way for other women who are just like you, who need help, who are looking for information, valuable information on the internet. This is how they're going to find it. So go on Apple, give me a 5-star review if you love this podcast. If you want to support the podcast, the best way to support the podcast is through the website. If you need help through your journey, if you need help finding a surgeon, if you want to join the membership, if you're looking for Bruise Juice, you guys don't sleep on Bruise Juice. Y'all know I have my Bruise Juice 30 coupon code for y'all to use if you're having a BBL, if you're having liposuction, if you're having a tummy tuck, if you need to be using Bruise Juice all over your body. Stop using those other brands that are not tailored for your post-op recovery. Bruise Juice is formulated for your recovery. It's amazing. It nourishes your skin. It helps your fat transfer live. Don't sleep on Bruise Juice. Bruise Juice 30 is the code.
And don't forget, new episodes every Monday. I'll see you then.